Hi, I'm Virginia from Right Clinic, and here with me today is Shatabdi. Thank you so much for being here.
Thank you, Virginia, for having me. It's a pleasure and an honor to sit here and talk to you.
Thank you so much. That's really kind. So, I think your story of getting into medical writing is really inspiring, especially for people who are dentists. So, do you want to talk a little bit about what you do and how you got
Yes,
into it?
definitely. So, Virginia, I am a pediatric dental surgeon based out of India, and I transitioned into medical writing, of course, accidentally, like most of us do. And that was back during the first wave of COVID in 2020 around. And so I was just out of my post graduation at that time, and hospitals and clinics, everything were shut. So I was kind of trying to, do something that I love to do, which is basically writing and reading. Along that lines, I got introduced to medical writing, and then again, Google search and all that made me land on the exact terminology of medical writing, and that's how I stumbled across this path. And so I did an internship first with a medical communications agency because, of course, going ahead, we don't know the nitty gritties of the how the industry works, right? So I did that for 6 months, and that was my best learning experience. That is the place from where I got the maximum exposure, feedbacks, and everything, like initially. And then I continued with that agency for another 2.5 years. So, as a remote medical writer with them. After
Amazing.
that, I decided to kind of transition into freelance medical writing. So, there were, basically, if you ask me what is the reason why you transitioned, I will tell you there is only one reason behind it. That is, I wanted to explore my full potential as a medical writer. So I was stuck with working in certain kind of therapeutic areas and drug markets, and I wanted to explore the global market and different other therapeutic areas. So that is exactly when I decided to, take it freelancing.
Amazing. And so, what kind of therapeutic areas were you writing about in the agency? And then, what
Yeah.
kind of areas do you write about now as
Yes.
a freelancer?
Yes. So in the agency setup, I was writing about respiratory diseases, gastroenterology, cardiovascular, the conventional therapeutic areas that we have, mainly these three. But I also wanted to explore the dental aspect of it because, of course, my core academic skills are aligned with that. So that was one thing I wanted to explore. Also, the different kind of deliverables. Like I was only working on, promotional kind of literature on that part. So I wanted to explore different other kind of deliverables which we can create in medical communications. So that is why I kind of thought that freelancing would be the best way to go about it.
Great. Do you want to give an example of some deliverables? Because I think for the
Yes.
audience who's not aware what a deliverable is, it's usually a type of document or it's a type of thing that you will usually produce. So whether that's
Yes.
like a blog
Yes.
article or a leaflet. So what kind of deliverables did you work on?
Yes. So as I said in the agency, I was mainly doing promotional kind of literature and website content, of course.
Mhm.
Out of the agency, I started creating health blogs, health news articles, white papers, then infographics, and all those visual kind of documents. CME slide decks was again a major part of what I started doing. So yeah, these were the different kind of deliverables that I kept exploring.
Brilliant. And so you mentioned you wanted to kind of explore global opportunities. So what kind
Yes.
of clients and where in the world did you find them and how have you been working with them?
Yeah. So, Virginia, this is very amazing the thing to tell you that like most of my opportunities have come exclusively from LinkedIn, exclusively. So you will not find me on any other platform, at least till now. So I am not on YouTube, I am not on Instagram. I'm very bad with Instagram, in fact. So I started doing these videos, but the kind of person I am, I don't think I can do that. So, so LinkedIn has been my sole place where I have gotten around 99% of all my global clients, Indian clients, everybody. So that has been the most amazing place for me to, attract people and get clients.
Brilliant. So, have your clients mostly been from different areas of India or other countries as well?
Some Indians and of course some global opportunities. So I have worked with agencies and people from individual clients also from
Mhm.
Dubai, from Lithuania, from USA, from Canada, and India. Yeah. So that's kind of till now, that's my base. Yeah.
Amazing. So, what would be one of your top tips for people who are trying to get into medical writing now?
Yeah. So, Virginia, a lot of people are actually asking these questions like newbies. So, ma'am, how can we get into it? I'm sure you must also be getting these kind of questions all the time. So, one of the best things that a new person in this field can do is develop their core reading, writing, and researching skills. Because that is a non negotiable. You cannot do without that, right? So, that is the first thing. The second thing is build your portfolio because that is one of the first things that a client will ask from you. And if you can't show them a relevant portfolio, then basically you are losing out on the very first step, right? So building a portfolio is very important and building a very good and genuine network. That is very important. Because we are at a time where uh, connections are very much virtual, so we don't actually make genuine connections. So if we can do that, then it will work amazingly in our medical writing careers because there is a good word of mouth that spreads, right? And you get referred back from your previous clients. They come back to you with new projects. So there will be a time in your career when basically your whole business will be built around referrals and word of mouth. So I think that is an amazing thing, and people should actually leverage digital platforms to, specifically, if I can say, it's LinkedIn to, get these opportunities.
Yeah, brilliant. I would say you really champion LinkedIn a lot. And so, what would be your kind of top tips for making LinkedIn work for you? What's your kind of strategy for finding clients or networking?
Yeah. So this is, not a standard map that works for everybody. So when I started with my LinkedIn journey, I was not very sure what kind of content to create. So, and I still remember one of the first contents that I created. Like they did not garner any claps, no reactions, nothing, because I did not know what to create. So I was creating random things. But then gradually I found out something that works for me. So I usually keep it a mix of educational posts, sharing my resources as a medical writer, talking about my client works, testimonials, and yeah, that's it. So that's like my whole LinkedIn thing. And I would suggest for anybody who is beginning to explore LinkedIn, first don't put yourself into the position to niche down initially. Like, don't talk about a particular thing or a particular therapeutic area just because somebody tells you that it's very important to niche down. I think it's very important that you explore different formats, what works for you, and then ultimately you can understand that, okay, so these are the kind of posts that are actually, working for me, and then you stick to that, do more of that, basically. Yeah.
Yeah, that's true because you're not sure what kind of things you create are going to appeal
Yes,
to different people. So I agree. I think experimenting is really important.
really
And
important.
so, what would be your kind of next steps as a medical writer? What do you see for yourself in future? Because you're freelancing right now. Can people learn from you about medical writing, or can people follow you on LinkedIn?
Yeah, so basically, I am working as a freelance medical writer right now, and I plan to continue that, of course, in the coming years. And I am also launching my newsletter on medical writing. So it's planned to be launched this month only. I haven't, kind of planned on the dates yet, but this month it's happening. So yes, that's something new from my part. And also, I am running a workshop, which some of you might be knowing about. So this is basically a 7-day workshop that I run around medical writing. And this is the fifth cohort that I have planned this month. It's beginning on the 18th. And I talk about it on LinkedIn, so people know about it mostly. And yeah, so that's on my cards right now. And I'm also looking forward to explore new therapeutic areas where I haven't worked before, because that will really help me to grow my, kind of skills as a medical writer. So yes, that is something I'm looking forward to in 2025.
Brilliant. Thank you so much. I will leave a link to everything that you've just said in the description box below. And I really look forward to your newsletter as well. That's very exciting. So
Thank you,
check out,
Virginia.
yeah, so check out Dr. Shatabdi's workshops and her newsletter and follow her on LinkedIn. I'll put all the links in the description box below. And thank you so much for your time today.
Thank you, Virginia. It was very nice meeting you. Yeah.
Thank you. Lovely to meet you too. And thank you everyone for watching or listening. And we'll see you at the next episode.